Hello, hi, good evening everyone. Welcome to another live session by IILT. So we will be looking into the OET Speaking module today. So I hope you are all doing really well and your preparations are also going really fine as well. So in today's live, we will be looking into very important things that you need to know as an OET candidate. So usually I come with the display one with the task analysis and things like that. But for today, we are going to look into other key elements. Those are very important when it comes to your preparation and also which will help you to bag a B grade very easily as well. So today we will discuss that, and in the coming lives, yes, we will get back to the task analysis and I'll show you how easily you can construct these sentences for each task and understand the cue card and understand the context clues and everything like that. So for today, as I mentioned, we will be going and discuss about the few areas that or few things that I feel why students are not getting a B grade or what is going wrong, or rather I would say I'm going to discuss 12 important things that you as an OET candidate should definitely do when you start to prepare for OET speaking. So I will be explaining those points, and as usual, if you have any queries about it, feel free to raise it. I will definitely get back to you on that, okay? So there are a lot of problems each one of us face, because when it comes to OET speaking, it is a productive skill and it totally varies from person to person. So the way I talk will not be the way you talk, or the way you talk will not be the same way your friend talks. So it varies. It is based on the way you can communicate, you can understand the context, the way you can construct statements, the way you can show empathy and things like that. There are a lot of parameters that accounts to when you are communicating or when you have to be a good communicator there. So it totally differs from person to person, as I've said. But there are a few things that you can do all together to get a good score for the OET speaking, or to make sure that you will definitely get the B grade. So those are the points that we are going to discuss in this particular live. So as I said, we will have 12 points that to discuss, and if you have any queries or anything, you feel free to ask me that as well, okay? So let's get started with the session then. So the first point that I would like to discuss is about assessment criteria. Yes, we do have 2 assessment criteria, and whenever I ask the students, when I take the online sessions or mock test or even regular classes, I ask them, do you know what are the criteria, or do you know what you will be assessed on? So they say, yes, we know linguistic and clinical communication criteria. Yeah, that is right, absolutely right. But then my next question is, what is it? Or what are the parameters that will be considered under the linguistic criteria? On the other hand, what are the things that will be considered under clinical communication criteria? Then again, they will list out the name: intelligibility, fluency, appropriateness of language, grammar. Yes, everyone knows it. But what is it exactly? You really need to understand what each criterion is indicating, or what is that going to assess in your performance, or what is the relation between that parameter and the way you present something there. So you need to understand what exactly it is. So you really have to sit and learn, not learn, I wouldn't say learn, but still you need to be very familiar with assessment criteria, what exactly it is, what it is asking from you. You need to know there are 9 parameters altogether, clubbing both the linguistic and clinical communication criteria. And you do have 6 marks for each of the linguistic criteria, and you have 4 parameters that will come under the linguistic one, which will in a total will account to 24 marks. On the other hand, you have 5 parameters under the clinical communication with 3 marks each, with a total of 15 marks. So you need to know when will you get a 5 for intelligibility, or a 6 out of 6 for intelligibility? Or what will happen if you're hesitant, or if you have pauses and lapses while you're talking? Will your score come down, and in which parameter the score comes down? You need to have an idea about it. Only when you know where you can lose scores, that is the time you learn how to gain that score. Only when you know that, you can move on and improve your skills. So it is the first thing that you have to do. Take some time to go through the assessment criteria and go through it, learn it and understand. So there are certain points that they will check under these points. Say for example, under the intelligibility criteria, they will see how clear you're talking, how good is your pronunciation, or they will also assess the level of stress or strain the examiner has to input to understand what you are saying. If they have to strain to understand what you are saying, that means that there is a little bit of clarity problem in the way you talk. So you really need to work on that. So you need to understand, okay, if the examiner has to strain, say for example, at 10%, then what will my score be? Will I get a 6 out of 6, or will it come to 5? So you need to have an understanding of that. You need to know what is fluency. Fluency doesn't mean the ability to talk continuously without any breaks in between or in a single breath. That is not what is fluency. Fluency means the ability to talk with proper pauses at a normal or a moderate rate of speech. That is what is fluency. And when it comes to fluency, your occasional hesitation, your occasional corrections, if you made a mistake, and if you're correcting it occasionally, these all things comes in fluency. So you need to know what are the things under fluency, and when will you lose the score. So all these things are clearly mentioned in the website. You can go through it and get an understanding about, yes, these are the criteria and these are the sub points that I need to keep in mind while I'm doing the test. And that is very important when it comes to your preparation too. Okay, because it is very or equally important that you know which area you lack. You need to have an idea about which is your stronger point, which is your weaker point, and based on that you have to improve on it. So today when I was actually talking to my students, and it was a mock test. So in IALT we do conduct mock tests every Friday. So I was cross-checking the scores they got for speaking, and on the list we have 4 different columns, or we can actually input the marks of 4 different tests on one single paper, front and back. So I was just cross-checking all the 4 times how they performed, their improvement, or the way they actually went back, or where they have progressed. So when I checked it, I've seen many students, they're getting a constant score, or they struggle in one particular parameter, but they don't come forward and ask like, okay, I have been getting so and so mark for fluency for all the modules or the mock test, but they never ask like, what can I do to improve it? That is the problem that you have to change. When you realize that you are not improving on one particular parameter and you're not getting an improved score for that particular parameter, it is your responsibility to go and ask your respective trainer, I'm finding it difficult to get a good score in this particular parameter. What should I do? Do you have any tips for me? That is your responsibility. Yes, you should ask for help. For that, you first need to know about which is the area that you are lacking. Once you have an understanding of that, then yes, you can seek help and the trainer will definitely help you on it. So I told my students about it. See, these are the problems, and you have low score here and continuously you are getting the same score for this particular parameter. You're not improving. That means that you need to go and ask for help. Definitely the trainers will help you, because the trainers will have an idea from the experience they have. They will tell you, okay, if you do like this, you can improve on this area. So you really need to understand where you are standing, and for that you need the criteria. You need to know what is your weak point, and based on that you need to ask help about or tips about how you can improve that particular point, and then you can take it from there. So that is the first and foremost thing that you have to do. It's very important. It is significant. Only when you know your criteria, you will be able to move forward. When you talk, you'll understand, yes, I need to say this word, I need to use this statement, I have to question my patient right now, I have to check the understanding of the patient. You'll get all these ideas, and the PDF that you can find online, when you just type OET speaking criteria on Google, you will get a beautifully designed PDF with all the information which is crystal clear. You just need to read through it, and it is very much understandable. You just have to read it once and you will get that idea very easily. So make sure that you do it today itself, and that is very important. And we do know that we have an exam coming very soon, that is December 17th, and for those students, it's never too late. Okay, you still have time to go back to your assessment criteria, and you can just say, okay, these are my criterias, and you know where you're standing right now. So you do have 1 more week to just polish all those things right now. And for beginners, if you're planning to start your session or practice sessions right now, start from your assessment criteria. Okay, that is paramount. Once you know it, then yes, you can have a meticulously organized study practice or a learning process, and that will definitely help you to boost your score. So that is the first point that I would like to discuss today. Assessment criteria. You need to know what is your assessment criteria. So that is the first point. The second point I want to tell you is again about the linguistic and the clinical communication criteria. All the students, they kind of like have this confusion about which is the important criteria among these two. Both are equally important. Yes, one is assessing your language skills, which is the linguistic criteria. The other one assesses your communication skills. So both are equally important here. Now, when we look at the weightage, yes, the linguistic criteria has more weightage. It has 6 marks for each of it. And the communication criteria only has 3 marks. Yet, it would be a little difficult for you to get that 3 marks compared to the 6 marks for the linguistic. It's my personal opinion, okay? Because when it comes to the communication area, in order to get that 3 marks, you have to convince another human being. The one who is listening to you should feel that you have showed empathy. That person should feel convinced about it. That person should feel, yes, there was a good rapport, or the patient or the nurse could understood what my points were, and that human being or the listener who is listening to you should be convinced, yes, all these parameters were there. And it is a bit difficult to convince another person, right? But if you have the language skills, if you have a proper practice for the language, yes, you will gradually improve on the linguistic skills. You just need the repeated speaking practice for it. So to an extent, yes, you can get a better score there. But when it comes to the 3 marks for the clinical communication area, it can be a little tricky. You need to put a lot of technical applications there to get that desired 3 score. So you need to plan it accordingly. You need to have a proper organization. You need to know the parameters which comes under each of it as well, so that you will have a clear-cut idea about, yes, this is how I should do. These are the important points I should include. So then it will be a little more easy for you. So that is the second point. First, you need to know your assessment criteria. Secondly, you need to know in depth about it, okay, where you have to give more importance to. So for some people, they would be really good at linguistic and they would lack a little bit of communication ability. So what you can do is, yes, I'm strong at my linguistic criteria. I don't have any linguistic barriers. I can speak really good English. But I find it a little difficult to communicate because my empathy is a little weak, my voice modulation is not up to the mark. So if you know that, then you can score more for your linguistic and then try to manage the leftover score in your clinical communication area, and vice versa too. For some people, they can be really good communicators. Beautifully, they will explain all the points, like they will show the empathy, the reassurance will be there, acknowledgements will be there. But when it comes to the language, the grammar accuracy or the fluency part and things would be a little bit in a messed up way. So if you feel like you have a stronger area like that in one particular criteria as a whole, then you need to stick on to it, hold on to it, try to get more number of scores or try to get the best score there. And if you have a deficiency, then try to get it from the next criteria. So you have to plan it accordingly. Then the next point is also related to this. You have to understand your weak point and you have to have a self-assessment. It is very important that you start self-assessing yourself because you need to know where you are standing, not just speaking, okay? You need to have an understanding about how much you have progressed since day one for all the modules, okay? Not just, it is not just restricted to speaking, be it writing or reading or listening. You need to understand, okay, for in day one I was like this, so 10 days later I'm here, 20 days later, where will I be? So you need to have a target and you have to see whether you have reached that target, or if you couldn't reach the target, you should see, okay, what was I lacking or what am I lacking? And based on that, you have to push yourself forward. And that is how you should do it. Do not just come to the, go for the online classes or come to the regular batch or sit there from morning till evening and do the materials, go back. No. It is not like a very casual routine that you should have. You should have a properly designed learning plan. You should have a study plan. You should have set strategies. You should always challenge yourself to move forward with, set goals. That is very important when it comes to the learning process. And if you have this properly organized, meticulously designed study plan, that is definitely going to help you, because you will certainly learn a lot of things and that can be easily applied and implemented to get a good score as well. So that is the third point that I want to tell you guys. The fourth point is regular practice. So normally what happens is, if you're taking online class, you will contact your trainer, you will talk for maybe about, maybe the class will be for 30 minutes and you might do 2 role plays or 1 role plays there. And the maximum time you talk in English is for about 5 to 10 minutes. Other than that, you don't. And when it comes to regular batch, you might do 1 or 2 role plays. Again, that is 5 to 10 minutes. And that's it. End of discussion. No, that should not be the case. You should find yourself some time to practice the language. The way you practice reading modules, the way you practice listening, the way you write a lot of letters to improve your writing skills, the same has to be applied when it comes to speaking as well. The more you speak, lesser your mistakes will be and lesser your problem or fear to talk as well. So go out and talk. If you are in a regular batch, communicate with your colleagues. Okay, you have a lot of people, there will be some people in the exam room, the batch or the classroom. So talk to them, have conversation, basic conversation. When you see in the morning, greet them. Hi, good morning. What did you do yesterday? Did you do this? Okay, or I have some doubt in this. Can you help me with it? Try to develop conversations. Kind of pulled back, but that's okay because you're not used to it and this is not a regular routine for you as well. So it is quite normal to feel that pull when you start to talk in English. But once you do it, the second day will be a little more easier than the first day. So as the days progress, it is going to be more and more easier for you, and the distance between you and the English language will slowly come down, and you will feel more confident to talk as well. And trust me, it really happened to me. Even I was not very confident to talk in English right in the beginning or when I was in my school days. Gradually it improved. I started talking in English all the time. Or when it comes to my teaching career as well, I've been doing this for the past 4 years and so I'm doing this every day. So the more I talk, the more I'm comfortable to talk this language as well. So you need to develop that habit of talking all the time. Whenever you get time, just communicate. Okay, just try to talk, maybe with your friends, family, brother, sister, husband, wife, whoever it is. Try to speak at least for 30 minutes a day, and you will definitely see the changes in the way you communicate, and it will do wonders for you as well. So try to inbuilt the habit of talking in English all the time. So it is very, very important for you. So that is the fourth point that I would like to discuss. Trust me, guys, just by doing 5 minutes role play, it's not going to help you. Unless and until your language is excellent, that will be fine. But if it is not, if we find it difficult to communicate, if you feel lack of confidence, if you feel like you cannot construct statements, then you should start right now. Try to talk in English whenever possible, and it will definitely help you in later. Okay, so that is the next point. Now let's look into the fifth point that I would like to discuss with you guys is make a list of the common mistakes that you tend to make in terms of grammar, sentence constructions, and things like that. Okay, so whenever you talk, you make grammatical mistakes. Everyone makes grammatical mistakes. So you would know, okay, this was a mistake, or your trainer will tell you it was not like this, it was supposed to be like this, or the tense was wrong. In this context, you have to use the future tense, not the present tense. So the trainer will guide you as well, and you would know it too. Make a list of the mistakes that you made and train yourself not to repeat the same mistake you made today tomorrow. If you made a mistake today, and when you come for your speaking test tomorrow, make sure that you are familiar about the mistakes that you made and you are prepared not to repeat the same mistakes again. It is very important. Okay, when you purposefully do it, or when you put that external force to yourself to not to make the mistake, you are learning it. So one time, if you could successfully do it for just one time, trust me, it will not be repeated again, because you did it already, and it will get feeded in your mind, and you will not make that mistake again, because whenever you talk, it's a mistake, and you will get the signal, and you will not make that mistake again. Okay, so you need to know your mistakes. Okay, just make sure that if you commonly make the mistakes, grammatical mistakes. So if I give you a couple of examples, it will be, people always say father condition, mother condition. It's not right. You have to say father's condition, mother's condition. So if that is a mistake your trainer always points out, write it down. This is a mistake, I always make this one, and then write it off, and you should know it. And the next time you talk, try to put an external effort not to repeat it. It is going to do wonders. Trust me, the mistake can be reduced. So try to have a practice of doing it. Now that is about grammar. Now coming to sentence construction, say for example, you opened a statement, the opening statement was wrong, you didn't understand the context clearly, you assumed it will be, a noun setting, but in real it was a noun setting, and you made a mistake, and the trainer after the role play told you, no, this is wrong, this was like this, so you should have started your opening statement like this. Make a note of it. Do not just listen and shook your head like that. Write it down, label it, note it down. Okay, say, okay, the pattern was this, the context was this, so in this particular case, this is how I opened the conversation. So the more you list it down, it is going to be feeded in your mind as well, so you will understand the pattern. So the next time when you see a similar setting, you will automatically use the same opening statement the trainer taught you. But you need the habit of listing it down and reading that, so that will definitely help you. So starting from today, develop the habit of making a list of the common mistakes that you tend to make when it comes to grammar accuracy or sentence construction or opening statement and anything like that. Okay, so whenever the teacher tell you this is wrong, make a note of it. Do not just sit and say, okay, yeah, don't do that. Make a list, and then next time try to avoid the same mistakes. So that is how you do it. Now, next point I need to tell you is always try to plan your opening statement ahead. What is opening statement? Opening statement is nothing but it is the way you start the conversation or initiate the conversation. So unlike any other proficiency test, when it comes to the OET speaking test, you, the nurse, you are the one you should take control of the conversation, and you are the one you should, who should start the conversation as well. So you really need to have an idea about how to start the conversation before you even start your role play. So during the 3 minutes preparation time, the first thing you do is you look at the setting, you read the background information, you read the task number 1, and you will finalize, yes, the context is like this, so this is how I'm going to start my conversation. So develop your opening conversation and just note it down somewhere on the cue card for you to remember it later. The reason why I'm telling you to note down the opening statement is because normally when you talk or when you start the examination, the possibility of you being nervous and you forgetting things are really high. And if you forget your introduction and if you mess it up, it is going to affect your confidence a lot. You will start to think like, oh, I messed up my introduction, I'm gonna mess this entire role play, or I'm not gonna get the desired score. So your confidence level will drop drastically if you're not having a good start. So do this regularly. Whenever you do the role play, make a note, okay, just jot down, this is a setting, this is the context, so this is how I'm gonna start my conversation. And trust me, it will definitely help you. So once you have a good start or a good kickoff, it is going to bring a relief for you. You will feel like, oh yes, I had a good start, and that will help you to have a beautiful conversation too. Okay, so just make sure that you make a note of the opening statement by reading the setting, background information, and the first task. These 3 things are very important when it comes to framing your opening statement. So that is the main thing that you need to know. So the next point that I would like to discuss with you guys is plan your movement or task progression beforehand. During the 3 minutes preparation time, do not just waste your time reading the task and circling and underlining or just scribbling here and there on the cue card. It is not going to help you, because I have seen a lot of people, what they do is they circle and underline a lot of points given on the task, and they will even write something between the tasks as well. Then later, while they're doing the role play, they find it difficult to read their own handwriting, because it kind of like got lost in the entire cue card, because they wrote it really fast and they just had a very minimal space there, and in between that space they kind of like scribbled it, and now they can't read it. It's not legible, no, legible anymore. So you really need to stop doing that, and make sure that whenever you make notes, you do it very neatly, not between the lines given in the cue card. You have to write it on the margin space which is provided there, because if you write something in between, it's not going to be legible, and that might affect your flow of the conversation. And if the flow of the conversation is affected, it can bring down your score for most of the parameters too. So let's stop doing that. Instead, what we can do is we can just do or try a mapping method. And what is a mapping method? Mapping method is nothing but we are going to map the flow of conversation right from task number 1 till the last task. So at the end of each task, you just put an arrow which is going to the next task. Okay, like this. You just put an arrow and write down how you have decided to move from that task to the next task. Again, you have to put an arrow from task number 2, which will end at task number 3, and write how you are going to move from task number 2 to 3, and so on. Now, how will you decide on how to move from one task to another? You can use 2 methods. The first one is you can use a connector depending on the situation. Okay, depending on the task which is mentioned there, what is the context. Second method, you can ask a simple question. Is there anything else you want to ask me? Is there anything else you would like to discuss? Or you can even ask a question related to what is being said in the next task. Say for example, if a next task says about the treatment options and you know that you have to discuss the treatment options there, you can ask a question even before that. You can ask a question like, so do you know the treatments available? Or do you have an idea about the different treatment modalities? So when you ask a question like that, you are having a proper transition from the previous task to the next task. So you can easily move, and this progression should also be noted, and it is a must. I won't say for everyone, but this point is important to those students who find it very difficult to move from one task to another. It is important for those students who get stuck and get blank while you're doing the role play, because some people are there, they'll just read the role play and they'll be like, okay, what is next? Where should I go? Where should I start? So this confusion can occur. Okay, it is very common. I've seen it a lot of times for my students also. So then I tell my students, this is how you do it. Okay, if you have difficulty to move from one task to another, the easiest way you can do is you can map it down. Just draw a map, okay, by using arrows. You point it out and then write to that. Okay, if I'm using connector, just write connector, or you can write down the connector that you're going to use. Say for example, if you have decided to use moreover, we have finished task number 1 and you're moving to task number 2, and in task number 2 also you're going to give an additional information, then you can say moreover I would also like to discuss. So when you write that moreover, you know, okay, now I have to say moreover and come to task number 2. Then if you have put question mark, you know, now we have to ask a question and come to task number 3. So you get that idea, you are getting a hint. Okay, yes, this is how I have to move. These are the techniques. So then you will not get stuck, you will not have lapses or pauses, or you will not break up in between. It is going to be a smooth conversation because you can see on your paper what is next and you have a guide. Do that. If you have the trouble of getting stuck in between, try to do this method. So you have to plan your movement from one task to another. That is called task transition, and as I said, there are 2 methods for it. The first method is to use any connectors depending on the context. The second method is to ask questions. Okay, either you can ask general questions like is there anything else, or do you have anything else to discuss with me, or you can ask a question pertaining to the context that you have to discuss in the coming task. Okay, and make sure that you do not ask the question like, do you have any other concerns, do you have any other concerns, every time after every single task. That will definitely bring down your score. Okay, don't do that. You try to ask different questions. And ask, do you have any other concerns towards the end of the role play, while you finish it off. When you are going to say bye-bye to the patient, try to ask that question, do you have any other concerns? Okay, then you can wind it up. So that is the 7th point that I would like to share with you guys. Moving on to the 8th point. Make a list of action words. Yes, action words are very, very, very important when it comes to the OET role plays. Every task has an action verb. Okay, so explain, confirm, console, tactfully tell the patient, provide, tell, inform the patient, collect, gather, explore. There are a lot of action words that you can find in your cue card. What should you do? You should know a list, or you should make a list of action words, okay, right when you are preparing for the examination, during your preparation time. Make a list of it. And along to that, you also need to have a small phrase that is associated with this particular action verb. So if your action word is confirm, then whenever you say confirm, you should use the phrase that you have prepared. Something like, in my examination, I could see that, or I found the presence of. So whatever sentence that you're preparing, you should learn it too. And if another example, if I have to give you another example, say for example, your action word was explain. So whenever you say explain, your phrase would be something like, I would like to tell you, or I have something to discuss with you. So you have to prepare a phrase, a small phrase for it. So it will be associated with the action word that you have listed down as well. So whenever you see that particular action word, you should see, or you should remember like, yes, this was a phrase. This is the one I should use. So you will get an idea about it, and whenever you are doing the role play, when you see that one, you can automatically have an opening statement. Okay, this is what it is. You will easily start. If your task is like explain the importance of doing exercises every day, and you have learned that for explain, the explanation for the action word is I would like to tell you. I'm just giving an example. There are a lot of other ways of doing it too, and this is a general example. Then you will start by saying I would like to tell you the importance of doing exercises. See, that is how you elaborate. So if you know the action word and if you know the phrase that you will use for that particular action word, then you got a beautiful opening for the tasks. Each task will have the action word, and if you know the explanation for that, then you can easily start that particular task. Okay, so try to make a list of it, and if you need a reference, I have already done 2 different videos for about 10 action words that are commonly asked in the OET role plays. So that video is available on our YouTube channel, so you can just search action words in our page and you will get it. There are 2 parts, and 5 in one and 5 in the other one, and there are sentences also mentioned in it. So if you want a reference, you can definitely look at it. Okay, so that is the 8th point. Learn and make a list of your action words. The 9th one, or the 9th point, is make sure that you have 3 segments for your task explanation. So whenever you see a task, it is not just the explanation of that particular task, it is more of how you present it. Okay, how you acknowledged it, how you explain the main points, and how you checked the understanding of the patient too. So I would say there would be 3 segments for each task, starting with the acknowledgement. Sometimes it will be acknowledgement, sometimes that particular task will be for asking information, so that acknowledgement will change into taking permission to ask questions. So depending on the situation or the context of each task, you have to change that too. So the first segment would be that acknowledgement part. Second segment would be task explanation. Whatever is given, you have to elaborate the key point and explain the points given there. And the last segment would be a small question. You have to ask a small question such as, is that clear for you? Are you following me? Or how does that sound to you, depending on the context. So if you're giving an information, if you're educating the patient about something, then after the task explanation, what you'll do is you will check the understanding of the patient. You will check whether the patient understood what you have explained so far. Or if you are giving a suggestion instead of giving an information about doing something or about a procedure, what you can do is you can check how the patient feels about it. Is it okay with you? How does that sound to you? Are you willing to do this? So these 3 segments is a very important part of each task explanation. Okay, so whenever the patient asks you a question, do not just directly jump into the answer, or do not just finish doing the task there. You need to have a proper system for it. First, acknowledge the question of the patient, and then explain what is given in the cue card about that particular task, and then finish it off with a small question too. I'll show an example. So imagine our task is like, say for example, explain or tell the patient it is important to cook food at home and eat healthy. Okay, and that is your particular task, and you ask the patient, so can you please tell me about your eating habit? So patient told you, I'm a very busy person, I can't cook by myself, I don't have much time, and things like that. Okay, so now we are going to explain the importance of it. So first we are going to acknowledge, Mr. David, I do understand that you are very busy and you do not get much time to cook food for yourself. However, it is very important that you eat healthy given your health condition. So I explain the task as well. And then I'm going to ask a small question. I hope you understand the seriousness of the situation. So that is how you're going to explain a task. You have 3 segments, okay? So then your task will also look little big. It will sound like you are giving a lot of information, okay? So try to incorporate these 3 segments: acknowledgement, task explanation, short question. Short question should be based on the context, okay? If you're giving information, the questions can be like, are you following me? Did you get the point? Is it clear for you? Things like that. And if you're giving a suggestion or if you're advising the patient about doing something, then your short short question would be something like, is that okay with you? Are you okay to do this, or are you willing to do this? How does that sound to you? And things like that. So make sure that you have these 3 segments. So that is very important too. And I hope it is clear for you guys. Now, moving on to the 10th point. Try to avoid repetitions. Yes, please. Do not repeat your empathy statements or your acknowledgement statements or even the small questions like, is that okay with you? Is that okay with you? No, don't do that. Try to learn different sentences for it. You do, you can find a lot of applications or free online websites which will give you different sentence construction. So you just have to go online and search free sentence rewriter, and you can just type in the sentence that maybe I'm sorry to hear that, that is a sentence that you're typing in, and there will be an option to rewrite or check or something like that. Then you just click onto that and you'll get a list of or a drop down of different sentences that you can use instead of I'm sorry to hear that. Improvise like that. Try to learn more sentence constructions and try to incorporate that while you're doing the role play also. That is very important. Try to avoid the repetitions because it will make the entire role play sound a little cringe. So try not to do it. Instead, try to learn a lot of different sentence constructions and try these free applications that are available online as well. Okay, so that will definitely help you. So I hope these sessions are being helpful for you guys, and you can try to incorporate some of these in your preparation as well. So moving on to the 11th point, make sure you always check the understanding of the patient and how she or he feels about it. Yes, this is the same point that I've explained a little earlier. It is important that you do it, and it has a score also. Many people, they don't know it. These questions like, is that clear for you? Are you following me? Do you have any other concerns, or is there anything else you want to ask me? How does that sound to you? These questions do carry a weightage. It can be added to your scores. So you need to ask this without fail. If you read the assessment criteria, it is clearly mentioned in that you have to check the understanding of the patient, you have to check and explore how the patient is feeling, not just how are you feeling, okay? Or when this feeling means whenever you suggested something, how the patient feels about that particular suggestion. So these small questions has got a mark or got a weightage. So you need to be careful about these small questions. And we just felt like, okay, those are just random questions that you have to use in the role play. No, those are just not random questions. It has a very important aspect, and you really need to start using it too at the right place. Okay, so that is another important point that you need to know. And the last point that we have to see is conclude the role play according to the context that you have been discussing so far. It doesn't happen very often, because whenever I do the role play with the students or whenever I see certain videos of the students, what they do is they're rushing to finish, and when somehow they reach the end of the role play, they are very happy that it is almost the end and they don't have anything else to discuss. So they just finish it up by saying, so thank you so much for your time, take care, and they're like, okay, it's done. No, it's not done. There would be a context, there would be a requirement of a patient. Okay, when this conversation started, the patient might have visited you for something. That something has to be mentioned in the end of the cue card. So today I was discussing a cue card with my students, and it was one of the previous exam question papers too. So it was about a mother coming to collect a sample bottle for the urinary test for her daughter, because the daughter has frequent urinary tract infection. So she is there for the bottle. So when she is going to collect the bottle, she has a lot of queries, and she is asking the nurse about how to do this, what to do this, and why is this happening to my child. So some questions there. So initially the mother told you, yes, I'm here for the sample bottle, the doctor said. So you said, yes, I'll definitely help with you. And then you are discussing all the points with her. But remember that you didn't give the sample bottle. The mother is there for the sample bottle. So when you finish the conversation, you have to ask like, do you have any other concerns? So the mother is saying, no, I don't have any other concerns. Well, I hope I have clarified everything for you. So please wait here. I'll go get the sample bottle and come back. That is how you should finish it. That is the entire context that was being discussed so long. So you really need to understand why this conversation is happening, why the patient is there, or why you are visiting the patient, or why the patient was referred to you. There will be an answer to that why. Okay, there is always a why there, and you should use the answer to that why as your conclusion. Always make sure that you do not just randomly end up your conversation. Instead, you give a proper close. Okay, so that is equally important when it comes to the finish of the role play, because as a good start, a good finish is also important, because this is not just an examination. This is when where you're showing that how good you can communicate, how good you can initiate a conversation and finish a conversation. So this is equally important. So these are the 12 different points that you have to keep in mind to get a B grade very easily. And trust me guys, if you know these points, it is going to be very easy to get this B grade as well. It's not an Herculean task. It's not a rocket science. Everyone can do it. Only thing you need to know is you need to have a proper study plan. You should start from the basics by learning the assessment criteria, and then you need to have a self-assessment about yourself, and then work on making lists about the common mistakes, the common words used in the role play, the common action words. So be prepared. If you're prepared and if you're anticipating these things, or if you're expecting, okay, this is going to be like this is going to be like that, if you are pre-planned and if you're all set like that, then why worry? You do not have to worry about anything else. Then you can automatically talk, and because you have planned everything ahead. So I hope this session was helpful for you guys, and once again I'm telling you, if you follow all these strategies, yes, definitely you can see the changes in your role plays. Okay, so if you find it helpful, and if you find it like it has helped you in a way that you can improve yourself, and if you notice any changes by using these methods, feel free to let us know. We'll be so happy to know that we have been helpful for you guys. Along with that, you can also comment your doubts and queries below this video, because this particular live session, after the live, it will be uploaded on our FB and our YouTube channel, so you can watch it there as well. If you couldn't complete it, then you can watch it there too, and then you can post your questions or queries, or if you have any suggestions about any particular topic that you need to discuss in the coming lives, then yes, feel free to do that too, so that we will definitely consider it. And if you find it really helpful, share it with other friends who are also preparing for OET. So I will see you guys next time with another interesting live. Until then, good night, take care.